I'm Elise Levine, the Executive Director for the Northern Valleys chapter. And tonight we are so fortunate to have Dr. Ilan Shapiro join us this evening. So Dr. Ilan Shapiro is the Chief Health Correspondent and Medical Affairs Officer for AltaMed Health Services. He is a board certified pediatrician, but his passion is to translate, as he calls it, medical-ish to actionable information. You may have seen him on your local news over the past couple of years on both English and Spanish TV stations talking about COVID, even participating in a Cruz Roja forum with Dr. Anthony Fauci. He told me to keep the bio short and the conversation long, so I'm going to honor his wishes. Dr. Shapiro is a personal friend of mine, as well as being a Northern Valleys board member, and I'm thrilled that he could join us this evening to talk about the ever-changing COVID rules and what's next. Dr. Shapiro.
Amelia, thank you so much for coming, and I hope that I create some type of sense of all this craziness that we have been feeling. And today they were asking me how I am actually feeling right now and how everything has changed. And a lot of people were like very confused with the mask mandate and it's changing and is this a time? And I'm going to start from the beginning, because if we don't tell the story from the beginning, it doesn't feel the same. Then 2020, we wake up, we start seeing more masks than usual on TV. We started to see, in Asia, you wearing a mask, it has been a common thing to prevent infections, pollution. There's a lot of things that I have been using the mask for. And we started hearing again, like this thing about, infections and people getting sick. And it started to smell like H1N1, influenza 2009, on MERS and SARS in early 2000s. And we were worried, because a lot of the experts have heard and have talked about having these coronaviruses that live in a lot of reservoirs in the community, in bats, in cats, in a lot of animals that we have contact with, and they can mutate and jump to another species, aka humans, and create a lot of headaches. And we started actually getting a little bit worried on that one, and we didn't understand where we were going. And of course, here in America, and by America I define the entire continent, like South, Central, and North. We, whenever we saw a mask, it was like, hell no, you're sick, or you're a doctor or a nurse. That's it. There's no prevention in between. There's no, I'm protecting myself to protect you, or you for me. No, it's, or you're a surgeon, or you're sick. And if you're sick, I don't want you to be even in my grounds. Then we started to see a lot of other people actually starting to grab masks. And slowly we started hearing that, we had one case, two cases of this thing, the SARS-2, whatever they were calling it. And we have had coronavirus for a while, and we have seen it in many different things, and we have very common coronavirus. It's actually one of the viruses that gives us the common cold very often in winter. But we know already that, and that's why we were starting to get worried, because in SARS and MERS, there are COVID-19 cousins. They were bullies. They were horrible. They were out there and having a mortality rate between 10 and 30% of people that were encountering them. And most of them were healthcare workers. Then we knew right now that if that was going to be the case now, we were going to lose a lot of people in the front lines. And if it's, it was a lot of we just didn't know. Then we started moving forward, and we started hearing, the thing about, do we close things? We can debate about masks, barriers, closing the economy, or whatever, but I can tell you for sure that all of us suffered greatly in the entirety of this. Mentally, physically, family members, and at the beginning it was very far away. We're like, damn, why am I even getting worried? I have not been to China. I have not traveled to China. Why am I worried? because it's a global world, because we have seen how fast we're growing as a human race, and we can transmit absolutely everything. And it's extremely hard to just stop it. And we created certain things to have like this sense of normalcy. And we started closing things. And I don't know if you remember, but it was like, okay, you cannot go to school. Your kids will have something called virtual school, that for all parents at the beginning, we loved it, right? Of course not. And it was, the kids loved it too. They were learning a lot. Then at the beginning was very complicated for all of us. It was an adjustment. It was not just the virus that was killing people, but all the adjustments behind it, the mental health of us, the family. And for the the essential workers, that we were going out there and do stuff was hard. Why? Because first of all, you're going like a soldier to the fire, or a fireman to actually fire, and everybody's running away from it. That's one. And the second one is that you don't want to actually bring fire to your own home. Now, there was a lot of feelings there that were actually crossing from one side to another. And I hope that you remember, we like the here in LA was practically the best time that I actually felt that driving in LA was worth it. I was cruising from one place to another in 15 minutes. I didn't know that Orange County was 20 minutes away from our offices. Then we were, a lot of good stuff actually was happening, and suddenly we started to adjust. Doing exercise more, talking about mental health, and the virus was still there. And suddenly 2020, the end of the year, we had the first spike that was horrible. Why? Because we didn't have a lot of understanding what was going to happen. We didn't have a lot of vaccines, medications, or anything. And people united, did stuff in Thanksgiving. It was a very difficult Christmas, New Year's, but it amplified the wave a lot. Then we started seeing hospitals overrun, nurses, doctors. It was bad. It was really bad. And a lot of the community members, that were hearing the message of, please don't go to the clinics unless you need it, or to the hospital unless you need it. That delay a lot of healthcare related issues. For example, patients that had diabetes, high blood pressure, cancers, and other stuff, and they were not going or getting healthcare because it was scary. Then you have the recommendations, you have this, then you start pushing away all other surgeries that were needed, but they were not emergencies. And the sad truth of who actually gets the respirator. We never had in the past 20, 30 years the need to actually talk about triaging respirators, or sharing a respirator with other people, or managing a lot of things that it's horrible. A lot of doctors were in intensive care unit trying to make sure that people were having the opportunity to breathe. But if someone was certain conditions or certain things, they will give the respirator to other people that had more or a better chance to survive. And that was, thank God, that was hard, and that was hard on the teams. And seeing how many people were coming in and just saying that you work with COVID-19 patients also brought a stigma with a lot of essential workers, healthcare workers, in hospital clinics. And but we were praying for 1 year. We were praying for a miracle. We were praying for something. And that miracle was, that we got not only one vaccine, we got 3 vaccines in a very short time span. And the miracle was not that the technology was created in 1 year. No. The technology started, as I told you, with SARS and MERS in the early 2000s. And we knew, because it was killing 10 to 30%, that technology was going to be helpful sooner or later, because we know that the coronavirus has jumped from one species to another. Then the miracle was that we actually created millions of doses for a large population, and it was safe, effective, and I'm going to repeat that words very importantly right now, because I was one of the first, probably 150,000 humans in the U.S. that actually got a vaccine in the early 2021. Then we had enough information compared to other vaccines, polio, pertussis, tetanus, and stuff like that, that it was safe. And usually when we have weird stuff, it's 6 weeks afterwards. We had weird stuff with one of the polio vaccines way back then. We have a lot of other stuff that were not enough activated, other ones that didn't work out, something with a rotavirus vaccine. But with this one, we were seeing good possibility of helping and being protected, and not only one, we have Pfizer, Moderna, and Johnson & Johnson. That's why every time that I talk about the COVID-19 vaccines, I put like this at the end, because it's not only one, it's three. And we got it. And I felt, I don't know, and I still get the goosebumps. I felt relief that I got it. And at the same time, I felt guilty. I was wondering why me, and why at that moment, and why we were getting it, if my family was still unsafe, or my patients that actually needed it more than me were not getting it. But that was a very short period of time, and after that, my wife got it, and after that, I as a parent, I did have questions regarding the vaccines for my kids, and I looked for the answers, and it was clear for me that if I wanted to protect my kids and have a fighting chance for them to go back to school in a safe manner with everybody else around them, and if they were encountering, the COVID virus, they will be safer with a vaccine than without the vaccine. Then that was a clear answer, and I got my kids vaccinated. And moving forward with all these things, there was a welcoming triage of information thrown at us. And Familia, I can tell you for sure that we failed in a lot of things. And we say we are all in healthcare, we are all in this part. And I will gladly, Mimi, I will gladly answer your question, and that will be part of the last part of the conversation. We failed, and we failed. Why? Because we didn't know how to talk with each other. That's true. As healthcare providers, as CDC, FDA, the American Academy of whatever, we all failed to communicate the truth. And the truth is that this is a new virus. We had limited information, and every time that we have information, we were sharing it, making sure that it's as much evidence-based as possible to make the best decision that we know with the information that we have at that moment. But when we were quiet and we were not activating a lot of the communication skills that we had, well, what happened? Well, there's a void, there's silence, and that silence, actually, you have something creeping in that is misinformation, fear, doubts, all the bad stuff that can happen. Our brain is designed to fill it out with something. Then we started hearing about miracles. People that go like, yeah, no, don't get that, get this. This is very important. They sent us these videos where people were like falling down, and it was very heartbreaking. But at the end, most of them will tell you like, but for $9.99, you can get this beautiful vitamins, and you can share this beautiful course. It's online. It's only $29.99, and we promise you that we. Then a lot of people were starting to play around, and we moved from science to policy to politics. And it was very confusing for the community. Why? Because we ended up, instead of fighting a virus, we ended up fighting each other. And that was horrible. And that was horrible. Why? Because having a more than 350 million people living here, it's a diverse country, and actually you can call it even little countries inside of the country, and we needed to accept that, and we need to have a conversation between what things actually worked in certain areas and what didn't work in certain areas, and adjust to that. And that's maybe part of the things of the conversation of the mask right now, that we know certain things that nobody can actually say anything against it. The virus is actually killing a lot of people that are vaccinated or fully vaccinated. And by that, I mean like as many vaccines as we can, like 2, 3 right now, are less severely affected by COVID-19, with less possibilities of ending up a hospital, complications in intensive care unit, and most importantly, prolonged COVID-19. That's happening with the kids and actually the adults also. And the mask and the vaccines have been key barriers for this. A lot of people start jumping like, Dr. Shapiro, but why the mask? Why the vaccine? Familia, this is actually like barriers. We need to have as many as possible. Then if you want to take 1 or 2, we can debate all night long, but we know that the more we actually close the door to COVID-19, the better it will be. And right now, and I'm going to, right now that we're on the last part of my introduction and all the stuff, because I really want to hear your questions and answer your questions. The sad part right now is that we know the answer for a lot of things. We do. We know what is the best things for us. And we need to clarify a lot of things, especially for our kids. This is not a simple cold. A simple cold doesn't give you inflammatory diseases or syndromes. A simple cold doesn't give you 1 in every 10, and there was an article today in JAMA. It doesn't give you 1 in every 10 cases, doesn't give you prolonged COVID, that it's from fatigue, and at least, and they measure a lot of patients actually that were COVID-19 positive from almost 30 days onwards, that had like fatigue, headaches, muscle pains, problems breathing, chest pains, and headaches, and the same thing with kids. Then that's not a simple cold. Then the kids will probably survive. Yes, they will probably survive. Yes. But I can tell you for sure that the hospitalizations that we're having here in LA County, in Orange County, and actually a big part of the chunk of the world, we are seeing more kids being affected. And a lot of people go like, what happened there? Why? We didn't know that part? Well, we need to remember a couple of things. And this is one of the things that we need to remember right now for the next following 6 months. For kids, we made sure that they were protected, safe, not at school, protected and safe from COVID-19, because some kids didn't have one at home, but they were at school, and most of the society was actually not playing around, and we were not expanding anything. By the 4th of July, we decided that the virus was, gone, and we threw away the mask, and we did a whole thing, and we did whatever we wanted to do. And what happened? Well, Delta started to pop in. Kids were also going back to school. There was more contacts. And what happened? A wave of new kids. So only in a couple of weeks, we had like more than 500,000 kids actually getting infected, thing that never happened during the pandemic. We thought that the kids actually were blessed with genes that would protect them against COVID-19. And it wasn't the case. We were protecting them. And at school, Omicron actually intensified the amount of kids actually getting sick. And we saw what happened on the hospitals. We saw what happened in intensive care units. And thanks God, the mortality rate is very low in kids, but we're seeing still kids getting affected, carrying complications from heart issues and other stuff because of the infection. And right now, this will be my last spiel from before I actually answer questions, is that right now we have an amazing moment. And we have the luxury to start the conversation and share with each of us and saying, well, you know what, we can figure out if we need as many masks as we're using right now. We can have a lot of other conversations. Why? Because this is our third cycle of our third winter. It was 2020, 2021, and right now 2022. Then, we know right now how it works. Then we have a choice. We know that it's going to get better by March, April. we just know, the numbers are going there. We have been doing a lot of things. We're making sure that we're not moving as much. We're using masks, we're vaccinating. And right now we're hearing a couple of messages that we just need to be aware of. One is that Omicron is less severe than, and actually I hated the first one. The first message was Omicron is less, it's actually milder than Delta. Then a lot of people were like, yes, let's get it now. If everybody's going to get it, I will get it now, and that way I'm done with it. But the thing is, we need to change the semantics, and the reality needs to be is that the reality needs to be heard like Omicron is less severe, meaning that anybody that gets Omicron right now can tell you that they didn't enjoy it, they didn't have fun, they were at home suffering, and a lot of them actually got prolonged COVID and everything else. Then make sure that this is not the moment to do COVID parties, because I was starting to hear that part. It's not a moment to lower your guard. The other thing is that if we're finishing the peak, we're almost done with the peak. Familia, the last time that I went to high school, mountains, you go up, and after that you need to go down. Then we still have a couple more weeks to go down. Then if all of us throw our masks, and again, it depends on the placement, the data that you live in, and a lot of other public health stuff. But if all of us just decide that, again, like 4th of July, that we're done, it will prolong the way going down. Then that's the things that we need to be doing. And what's going to happen from here until September 2022? And please don't take this as a prophecy, but we have already 2 cycles, and probably this will be kind of where we stand in September 2022. We'll start hearing more people going like, we don't need masks. You see, we're almost done with the peak. Why do we need masks? And after that, there will be other people like, I'm not going to vaccinate my kids to go back to school after summer. Then there will be a lot of conversation. Why? Because we just forgot what happened now, that we were losing between 2,000 to 2,500 souls every day in the US. And that's, we need to remember that, with 9/11, it was around 6,000. Then right now, our brain got numbed that something that was preventable was actually happening. Then whenever you hear that, and it's not about I vote for the orange party or I'm on the purple party. No, nothing like that. It's just facts and reality. Then we need to make sure that we learn from the mistakes from both sides. And we need to make sure that we use all the barriers that we can in an efficient way to protect what's going to happen in summer, that it will be, I think it will be milder. And again, by September, we will start having the conversation of getting your booster, making sure that kids get vaccinated before going to school and other stuff. And we do not forget this moment. It's very easy to forget when we were suffering, when we were hiding, 2020, the horrible, holidays that we had during many phases of this pandemic. But, we're going to start hearing that this will become endemic. And what would change to us? Absolutely nothing. It's like, it's just messaging that it's here to stay. And a lot of the resources and monies that, government and a lot of big institutes are giving away, it's going to start like drying out. And I hope that we continue doing a couple of things. And this is where my heart, I hope that someone actually upstairs hears us well, is that you cannot plan for an accident. You can't. You cannot plan to get COVID-19. You can try, but it's not something that most of us will try to plan to get it. But you can plan to make sure that you're using a mask, protecting yourself, getting the vaccine. Do I want to get 400 times vaccinated? Of course not. But if there's science behind it, and I'm protecting myself to protect my family, that's the other thing. And very importantly, and this is something that we have been voicing it for the past few months, is that you cannot plan to get in an accident. You cannot plan to end up in intensive care unit needing blood. But for sure, you can plan to donate blood today. And with all the stuff that we're seeing, and all the people that are ending up in the hospital, and the burnout from doctors, nurses, and everything else, some of the times we need to give back. And sometimes they go like, well, doc, you know what? It has been a tough year. You know, they lay me out, they reduce my hours. But there's things like giving a smile, talking with a friend, giving a call to a family member that you haven't called in a while, or donating blood. They're still free. And they are making, and that actually can make you feel better. Then those are the conversations that we need to be doing right now. We need to stop fighting the fight that it doesn't exist. The fight right now that doesn't exist is the part from human to human. It's not that you're anti-vaxxer and pro-vaxxer, pro-masker, or whatever, orange, purple, whatever. It's that humanity is actually fighting a virus, not each other. And then we need to remember that part. Then we need to turn around and see each other again as humans. Yes, and we will always have different feelings. But the way that we interact, the way that we create, and the way that we take care of each other, that's the thing that we want to share with our kids. We don't want them to actually feel that, they were part of this, and, mommy and daddy were always sad or screaming or trying to make a point that just double mask inside of your ears, or don't wear anything because, whatever. Then it's not about that. It's human against the virus. Then thank you. That was my spiel, and I have 1 more minute. Yeah. No, I'm ready for questions.
Muchas gracias. Thank you. I'm going to practice my Spanish. Ahora es el momento de las preguntas. So now is the time for questions, and we do have some in the chat, starting with Gerald. And Gerald is our COO, so he is always looking out for the greater good of all of us and protecting all of us. So he wants to know, how far away are we until we go into an endemic state?
Technically, there will be a lot of scientists and epidemiologists and doctors that will say that we are there. Then what will it change? Again, it's kind of the mental state that this is the way that it is, and it's jumping so fast that we cannot destroy it, and we need to figure out a way to have better medications and better vaccines in order to make sure that we continue doing the same. And probably we'll have next, like winter will be tough next winter, but we'll slowly get better. We'll never go back to 2020 where we were at home hiding. I think technology of the vaccines and the possibility of actually rearranging them, and the technology that we also have for rescue medications with antivirals and other stuff are working. And we need to remind ourselves that, the virus is still changing. The more people getting infected, the virus wants to survive, and we'll understand how to get us.
Got it. And Gerald also wants to know, the quarantine period has been reduced from 10 days to 5 days. Can you talk more about how this decision was made?
Yes, of course. It's one of my most exciting conversations. If you remember, it feels like 2 decades ago, but in 2020, we were talking about 14 days. In 14 days, and how do we measure this? When we have an infection, we can actually measure how much virus you have, and what's the possibility from you to sharing the joy of the virus to other people. Then we knew by 14 days, it was probably 99% that it will not be changed, jump from one person to another. Then that was the safest thing that we had. Then, the reality is that people were getting sicker, like more people were getting, infected, but things needed to actually continue to move. Then we need to do like a evaluation between public health, because electricity, then you need someone to operate that part. If you have a car accident, you need someone to actually have to be at the hospital to take care of you. Then there were things that needed to move, in the community. Then they reduced it to 10 days. Why 10 days? Because by 10 days, and I'm going to fake the numbers because I do not remember exactly the numbers, but it was around 85% that you will be, on the clear, and those 15%, it will be very weird that you can actually share it if you were using a mask. And right now with Omicron, it changed all the rules because it was actually, if Delta was actually getting people sick, like if I was sick and I had 10 people around me, with Delta, I could get 4 people sick or 3 people sick. With Omicron, we were talking about like 7. Then it was almost double the amount of people that were getting sick. Then if all of us get sick at the same time, it will be a problem. And a lot of us were sick, or not as sick as we could function. Then we knew that the first, actually 2 days before you start having symptoms, you start to share the joy of the virus, and the next following 5 days, it's kind of the peak, and after it falls very quickly from 5 to the 10th day or 5 to the 14th day. Then that was the idea, that knowing that those 5 days were the worst with symptoms, and having the opportunity to go back if you didn't have fever, if you're feeling better, and with a mask to do the things that you were doing, that was the idea. It was never, and of course, if depending where you were, if you were negative by the day, the 5th day, and that's kind of the recommendation that I give. It's make sure that you test yourself. we start giving sharing the joy out there to other people and that stuff, and that's something that I'm still a believer on that part. But but that's kind of the idea of it.
Thank you. And then Mimi wanted to know about New York and other regions are relaxing or doing away with mask mandates in schools. How is this safe at this point?
It's a beautiful question. And and it depends on, in all these places, by the way, they have like little asterisks, is that we're in the, the real story is that they know that cases are going down, and we can improve or start the conversation of doing less things that are cumbersome to certain parts of the population. Then you have less people getting sick. You could change stuff, and that's okay to have that conversation. The thing is, part of the conversation that New York is having, California is having, is that making sure that you do that, you have the opportunity to do it, but if local public health departments and populations decide otherwise, it will continue being upheld. Then that's the important thing of all the ones that are, sharing this thing. And my personal view is that this thing for me will continue to be in my pocket and in my mouth. Actually, not in my mouth, over my nose and mouth. To make sure that I'm protecting myself and my family, my patients, everybody else. And if I'm going to go to the Super Bowl, if I'm going to go to a lot of other places, I will continue for sure having that as a barrier for me. And why? Because I don't know if all of you saw the game from independently of all the crazy stuff that happened before the game, but the hockey players from Canada against Russia, they play with N95s. Then, familia, if anybody tells me that they cannot breathe and it's horrible, well, they played in front of the world in the Olympics, hockey, with an N95. And I promise you, probably they didn't train with it. Then it was a challenging moment for all of them.
Yep. And it was women's hockey. Amazing.
Yep.
So Thomas has a question. Since the pandemic started, there's been a huge division, conflict, heated discourse between the public's overall health and individual freedoms and rights. What changes do you foresee in future federal, state, and county policies regarding public health and herd immunity?
I think herd immunity will and by the way, it kills me when I say that, but I prefer like community immunity, because herd immunity, it's like, and then by the way, the correct term is herd immunity, but my feeling is the other one. But I would try for sure to make a point that we can all be happy at the same moment, and making sure that we understand the values that we have. We all want to protect our kids. We all want to be helpful and be safe and work and be happy. We all want, there's a lot of things that we stop seeing then, and it's very different. And we need to, one of the things that I was saying, the errors that we did as public health departments and doctors and everything else, is not a talk about who is more at risk and who can actually have more diversity and options that they have around the question. Then we need to talk about, if you live in a rural area that has 300 people and nobody sees each other and there's like acres between everybody, why have a Monday? But for example, if you're going to have a party and everybody's in New York on the subway and everybody is going to be 1,000 people per car, well, maybe you need to adjust to that. Then those are the conversations that we need to be having. And right now, the problem is that as humans, we have a very short memory. Then we were going to forget completely what happened right now. People will start voicing other stuff regarding, anti-vaccine sentiment, anti-science sentiment, anti-masking sentiment for the next couple of months, because they can. Because you see, there's no more people dying. You see, there's no more people going to the hospital. Then the discourse will be hard. That's why we need to go back to humanity. Plus, we have something called the midterms that will be quite interesting also. Then we have a couple of interesting things cooking there that we're going to see them through, and we will get to enjoy a lot of things. And the best things for all the people out there, and including myself, and I need to remind me this, is that we are in 2022. We have vaccines, we have medications, we have a lot of things. And I think that when you go to Mexico, I'm from Mexico, and you see people dying outside of hospitals because simply there's no beds, or there's really no doctors, or there's no oxygen. And people are dying from that. And you go, and we had multiple vaccines from multiple places of the world, but a lot of them didn't work that much. And we haven't even started vaccinating kids below 15 years of age. And when people come and talk to me right now about freedom, it's hard for me to hear it, because I do believe in freedom. I do believe in personal choice. I believe in, but when you have personal freedom and choice, you need to, assume the consequences. And a lot of doctors and actually insurance that were taught that, like the way that Singapore does it is that you didn't get vaccinated, no, right? For whatever reason, good. You got sick with COVID-19, yes. Well, you pay for your bill. The same way that people actually, when they smoke, it's a preventable thing, but they're choosing to do so. They have the freedom to do so, but the insurance will cost more. Then that's like freedom comes in both ways. It's and a lot of doctors were saying, well, what, if someone comes and I do not know if there were real cases or not, but there was a theoretical question with ethics and morale, medical ethics, that if someone actually was not vaccinated and someone actually was vaccinated, who do you give the ventilator to? Or where do you put your resources? We're hearing a lot of things right now, for example, with COVID-19 patients or people that actually need a transplant. And if you're not vaccinated, a lot of hospitals will not even put it on your list. And it's all about survival. That if you have the vaccine and you're going to get an organ transplant, they will give you a lot of medications that will make you immunosuppressed. And a lot of patients that are immunosuppressed, they, if they get COVID, they get more complications, and they have horrible complications, and they can probably have a higher mortality rate. Then why, if you have one heart, you cannot split it in two. Then who has the greater possibility of survival? Then that's where, that's the conversation about freedom. If you don't want to get vaccinated, there's the beautiful part of this beautiful country is that there's so many colors and flavors, and you can choose where to be. But part of it is the responsibility of what's happening. And we saw it in Texas. Docs, they were, kind of not doing anything, and they were actually needed to bring doctors and nurses from other countries and other parts of the other states to actually help them. And same thing happened with Florida. And Florida actually got even worse because they actually tried to get only the famous monoclonal antibodies, but from the three of them that we have, only one works, and they have only the other two, and very low doses of the one that actually works. Then right now with Omicron, it changed everything. Then a lot of people died without needing to die. And we saw it again and again with radio, talk hosts, TV sensationalists, and stuff like that. And the thing that hurted me the most was that a lot of people were going. They had this combination of fear, and fear is so. I'm totally okay with fear, and doubts. Yes, we need that, because that actually points us to be critical thinkers. But when they started doing pseudoscience and they started selling you pills and miracles, and it's about control, and in our reality, we're not there. Then the most important thing is making sure that we are all taking care of it. And the thing that I was telling and sharing with all of you, that the most important thing that we have right now is making sure that we do not fight against humans. We fight against the virus.
Perfect. Thank you. And Mariam wants to know, she's nervous about what the Super Bowl will bring to LA. Do you think case numbers will rise once again?
First of all, let me start with the positive side. I hope that we get a Super Bowl and in a cup. That will be, no matter where we are, I hope that we get at least that. I do believe that we have already had a lot of other things happening around the Super Bowl and big activities in LA County. Then I don't think that will create more headaches. It's not going to be, it's going to be packed. There's a lot of people coming and going. I'm more worried, instead of LA County, I'm more worried about the entire US and other countries, because a lot of people will come here and probably will get exposed, maybe not on the stadium, but outside in any activity they do, and they go out there. Then and I'm probably going to do, and that's my Thursday video that I'm going to be filming, is that if you want to do a COVID-19 safe party, you can actually do it. There's certain things that you can, all of us can do, and making sure that the more air, the more ventilated, more masks, more people with vaccines, and more space, the safer we are. Then that's a key factor that we have in front of us, and we can choose this. It's not a miracle. It's not like, oh my God, no, we can actually do that. And what will happen with the people, the souls that are there? I have no idea. I hope that they do well, but at least it's different than other times. At least they will be asking for certain barriers. Do you have the test? Do you have the vaccine? Do you have, yes, for all those skeptics, yes, you can fake all of them. Yes, you can. But at least there's like safety bells inherent there. They will try to give as many masks as possible. And the good feeling that I have here in my heart is that at least we are not in 2020.
Yep, definitely. Does anybody have any last questions? Please feel free to come on camera and ask, or put it in the chat if you want to be shy or you're feeding the kids. So I have a quick question for you. So I get hospital reports from Palmdale Regional Medical Center every week. And then also on the TikTok, I've seen these other hospital reports. And would it be, is it correct that it looks like when you've got, say, 20 people in the hospital for COVID, that 18 of them are in the ICU and 16 of those need ventilators, that all of those people are the unvaccinated, and the 2 that are in regular hospital rooms, so we're looking at like a 10 to 20%. Is that standing up through the country?
Yes. And a lot of people actually will go like, doc, why do I get vaccinated if people are still getting on the hospital and getting sick? The thing is, you never use a seatbelt thinking that you're going to get into an accident. Never. It's not like, oh, yeah, I'm putting my seatbelt. I want to find a wall and actually just press the pedal and get it. Of course not. Then our only seatbelt that we have right now against COVID-19 is actually the vaccine. Then it reduces not just mortality, hospitalization, complications, but also we're seeing right now prolonged COVID and other things in adults and children. Then yes, you're on the correct path with that one.
So we do have one more question. How do you personally stay hopeful in dire or uncertain times?
Tons of tequila.
Okay.
No, no, it's already off the clock. On reality, it has been. I'm going to tell you the truth. It has been hard. This joyful fellow that you see in front of you, it's joyful and it's a fellow, but I have had very dark days during the past 2 years and a half. And I have had, I have overeaten. I have not moved. I have went from one side to another on being depressed, anxiety, what it's going to become with everybody, problems with, mental health. The same pathway that we all went through. The thing that actually saved me the most were one that my social pathing around me was amazing. My wife, my kids, we passed through a lot of crazy stuff, but they were there and we could actually share a lot of the joy and sadness that we were having. The second one was making sure that we actually needed to be present. Then I started doing a lot of exercise. Even though that I was overeating completely, I was doing a lot of exercise. I understood the importance of mental health and meditation. Just a small commercial for Headspace. That's the app that I use. There's YouTube videos, and my feeling about meditation was like, oh, you limit yourself and you forget it. Not hell no, it doesn't work like that, but it helped me a lot. Then food, exercise at least 30 minutes, making sure that I was sleeping, because I was actually having a lot of issues, not going to sleep, but actually maintaining my sleep. Then I was having a lot of that type of issues, and making sure that I was by putting my cell phone, far away, making sure that I was not checking my Instagram account at 2 a.m. And stuff like that. And other stuff is, sharing that I was sad when I was sad, happy when I was happy. And not just with my family, but with my teams everywhere, and being very aware on what we were feeling and hearing, and those were the things that I think that we needed to share and everything.
And so Thomas has a question, but so Thomas, if you want to come off mute, but real quick, Headspace is something that is offered to all Red Cross employees for free. So big fan of Headspace.
I have it here. Yep.
Hello. So my question is regarding the Latino and Hispanic community specifically. There's been a lot of research kind of focusing on the health inequity found by the community at large, more so kind of even more influenced by COVID-19. And AltaMed serves predominantly the Latino and Hispanic community within OC and LA. How do you kind of push forward the notion to get vaccinated, specifically for those who are, like my aunt, she got COVID really bad. She was on oxygen tank for like 3.5 months. She's still not willing to get the vaccine. She was on the border of death and life, but she's still kind of, she's like, no, mijo, no es para mí, type of, mentality. How can we, or how can I help her understand, the consequences that she's dealt with without being too aggressive with my stance?
First of all, thank you for sharing this because you're not alone. There's a lot of people actually suffering with this, and and sometimes we want to scream and yell and go like, why, oh why? And sometimes we do, and we need to understand that everybody has options. And we were talking about freedom, and everybody has the freedom to do things. Then first of all is acknowledging, and when I have this type of conversations, I acknowledge the fear. I try to figure out what's the real problem. Is it coming from religion? Is it coming from med science? Is there more information that I can clarify? And sitting down and being quiet. That's the hardest thing, because we always go like, damn, you need the vaccine to survive. I want you to be alive. And it's not what they want to hear. They want to have their own answers. And most of people actually will share, you know what, doc, I'm worried about, this religious thing that it's having. And a lot of other stuff. Then it's a conversation, figuring out what's the real problem that we need to attend. The other thing is making sure that she knows that you're there for her, no matter what choice she does. And that the vaccines have been safe and effective. We have millions of people actually doing it, and making sure that you can share that information. We know it, we see it, and making sure that she understands the real numbers of people getting actually hurt by the vaccine, and most of them is pain in the arm, fever, malaise, and yes, there are side effects. Most of them are mild, and probably COVID will give you more heart attacks, more inflammation of your heart, more even clots than anything else in the world. Then that's kind of where we are. Part of the things that we need to figure out is giving that space. And the other thing is, at the end of the conversation, is not like, oh, are you ready? Let's go and get you vaccinated. Like, no, it's like, I'm here for you, and it's your decision. Giving that possibility and giving the power back, because they have it. Of you can decide if you want to get vaccinated or not. I will be here, and at the moment that you will be here, I can help you. I can be with you. I can drive you. I can actually get you connected with the services. And part of the things that we're doing on the community is this campaign actually called Ándale, ¿qué esperas? And it's kind of, come on, what are you waiting for? And it's not that part of actually getting you vaccinated, but it's, why not you start with a conversation? Why not you start with all these things that we have for all of you? And that's where we stand, and that's where we're supposed to be moving forward. And thank you so much for your question. And it was a very powerful question.
Yeah. So I just want to thank you so much for joining us. Abrazos, abrazos, abrazos. And we will see you again soon. Thank you again, everyone, and have a great night.